Did you know that right now, as you're watching this video, over 262 million people worldwide are struggling to take their next breath? And here's the terrifying part. More than 1,000 people die from asthma every single day. That's one person every 90 seconds. But wait, it gets worse. Many of you watching this might have asthma and don't even know it yet. Hello everyone, I'm Dr. Jason, and today we're diving deep into one of the most misunderstood respiratory conditions that affects millions globally, asthma. Whether you've been wheezing lately, experiencing mysterious chest tightness, or you know someone who carries an inhaler everywhere, this video might literally save your life. And trust me, by the end of this video, you'll understand why even world-class athletes like David Beckham managed to dominate soccer fields despite having this condition. So grab a comfortable seat, take a deep breath, while you still can, and let's unravel the mystery of asthma together. What exactly is asthma? Let me paint you a picture. Imagine your airways as highways, smooth, wide, and allowing traffic to flow freely. Now, imagine someone suddenly decided to narrow those highways, cover them with sticky mucus, and make the walls swell up like a balloon. That's essentially what happens in your lungs when you have asthma. Asthma is a chronic inflammatory disease affecting your respiratory airways. The inflammation causes the muscles around these airways to tighten, the lining to swell, and excessive mucus to be produced. This triple threat makes it incredibly difficult for air to flow in and out of your lungs. The result? Wheezing, coughing, chest tightness, and that terrifying sensation of not being able to catch your breath. But here's what makes asthma particularly sneaky. It's not constant. Unlike some diseases that affect you 24/7, asthma comes and goes in episodes or attacks. You might feel perfectly fine for days, weeks, or even months, and then bam, something triggers it, and suddenly you're gasping for air like a fish out of water. And speaking of triggers, the hidden triggers lurking everywhere. Now, you might be wondering, Dr. Jason, what causes these attacks? Well, buckle up, because the list might surprise you. Asthma triggers are like that annoying relative who shows up uninvited at family gatherings. They're everywhere, and you can't always predict when they'll strike. Environmental allergens, pollen from trees, grass, and flowers. Yes, that beautiful spring day? It could be your enemy. House dust mites living in your mattress, sweet dreams tonight, pet dander from your beloved fluffy companion, and mold spores hiding in your bathroom. These invisible invaders can turn a normal day into a breathing nightmare. Air pollution, living in a city? Those exhaust fumes, industrial smoke, and even that romantic fireplace can trigger asthma attacks. Studies show that people living in urban areas have significantly higher asthma rates than those in rural locations. Respiratory infections. Caught a cold? That innocent-looking viral infection could be setting the stage for an asthma flare-up. The flu, common cold, and even COVID-19 can all trigger asthma symptoms. Weather changes, sudden temperature drops, cold air, humidity changes. Mother Nature apparently has a grudge against asthmatic lungs. This is why ice skating legend Kristi Yamaguchi had to develop special strategies to manage her asthma in those freezing ice arenas. Exercise. Wait, what? Yes, physical activity can trigger asthma. But don't you dare use this as an excuse to skip the gym. Exercise-induced asthma affects about 90% of people with asthma, but it's completely manageable. Just ask David Beckham, who played professional soccer at the highest level for 20 years. Emotional stress. Remember when I mentioned psychological triggers? Stress, anxiety, even extreme laughter or crying can set off an asthma attack. Your emotions and lungs are more connected than you think. Medications. Aspirin and some blood pressure medications can trigger asthma in sensitive individuals. Always tell your doctor about your asthma before starting new medications. The shocking statistics you need to know. Let's talk numbers, because they're absolutely mind-blowing. In 2019, approximately 262 million people worldwide were living with asthma. That's roughly the entire population of Indonesia. And here's the kicker, 455,000 people died from asthma that year. That's more than 1,000 deaths every single day. But wait, there's good news hidden in these scary numbers. Asthma mortality rates have actually decreased by about 51% between 1990 and 2019. We're getting better at managing this condition, but we're far from perfect. In the United States alone, about 28 million people have asthma, and it costs the economy more than $81.9 billion annually in medical costs and lost productivity. Here's something fascinating. Asthma doesn't discriminate, but it does have preferences. It's more common in developed countries than developing nations. Why? Scientists believe it's related to the hygiene hypothesis. Essentially, our super clean modern lifestyles might be preventing our immune systems from developing properly. Who knew being too clean could be bad for you? And here's a gender twist for you. Boys are more likely to have asthma than girls during childhood, but this completely reverses in adulthood, where women have higher asthma rates than men. Science is still figuring out why. The warning signs your body is sending. Now, let's get practical. How do you know if that cough is just a cough, or if it's asthma knocking on your door? Here are the red flags. Classic symptoms. Wheezing. That whistling sound when you breathe, like your chest is playing a sad tune. Shortness of breath. Feeling like you just ran a marathon when you've only climbed a flight of stairs. Chest tightness. Like someone's sitting on your chest. Not a pleasant feeling, I assure you. Persistent cough, especially at night or early morning. If you're coughing more than a smoker, but you don't smoke, pay attention. The nocturnal pattern. Asthma loves the night shift. Many people experience worse symptoms at night or early morning. If you're regularly waking up at 3 a.m. gasping for air, that's your lungs screaming help. Exercise-related symptoms. If you wheeze during or after exercise, or if you're avoiding physical activities because they make you breathless, that's a huge red flag. The unpredictability. Symptoms come and go. One day you're fine, the next day you're struggling. This inconsistency is actually a classic asthma characteristic. Celebrity asthmatics who defied the odds. Let me tell you some inspiring stories that prove asthma doesn't have to limit your dreams. Remember David Beckham? That soccer superstar I mentioned earlier? He kept his asthma private for years until he was photographed using an inhaler during the 2009 MLS Cup. He admitted, "Sometimes I have good days and bad days. I've had it for a good few years now." Despite this, he won 19 major trophies and played for 20 years at the highest level of professional soccer. Then there's Jackie Joyner-Kersee, considered one of the greatest female athletes of the 20th century. She won 3 Olympic gold medals in long jump, all while managing asthma. She once said, "I was always told as a young girl that if you had asthma, there was no way you could run, jump, or do the things I was doing athletically." She proved them all wrong. Jessica Alba, the Hollywood actress, was hospitalized frequently as a child due to severe asthma. She once said, "I had really bad asthma and was in the hospital a lot from the ages of 4 to 12. Today, she's a successful actress and entrepreneur who even founded the Honest Company, partly inspired by her health struggles. Even Theodore Roosevelt, the 26th President of the United States, had severe asthma as a child. His father told him, "You have the mind, but not the body. And without the help of the body, the mind cannot go as far as it should." Young Theodore responded by becoming physically active, and the rest is history. The science behind your medications. Now, let's talk about the medications that can literally be lifesavers. Understanding how they work will help you use them properly. Short-acting bronchodilators, the quick relief heroes. Albuterol, also called salbutamol, is the superhero of asthma medications. When you take a puff from your rescue inhaler, albuterol works within minutes by binding to special receptors in your airway muscles called beta-2 adrenergic receptors. This binding causes the tight muscles around your airways to relax and open up, like opening curtains to let sunlight in. The effect lasts 4 to 6 hours, giving you that crucial breathing relief during an attack. But here's the important part. If you're using your rescue inhaler more than twice a week, excluding before exercise, that's a sign your asthma isn't well controlled. Time to see your doctor. Inhaled corticosteroids, the long-term protectors. These are the real MVPs of asthma management. Medications like budesonide, fluticasone, and beclomethasone work by reducing inflammation in your airways. They're like firefighters constantly patrolling your lungs, preventing fires before they start. Here's the catch. They don't work instantly. You need to use them daily for weeks before you feel the full benefit. Many people stop taking them because they don't feel immediate relief, which is a huge mistake. These medications reduce your risk of severe asthma attacks, hospitalizations, and even death by up to 50%. Combination inhalers, the new generation. Recently, there's been exciting news in asthma treatment. New combination inhalers like Air Supra combine albuterol with budesonide in a single inhaler. This means you're treating both the immediate symptoms and the underlying inflammation with every puff. Studies show this approach reduces severe asthma attacks by over 30% compared to using albuterol alone. Natural remedies that actually work. Now, before you start brewing weird herbal teas your aunt recommended on Facebook, let me be crystal clear. Natural remedies should never replace your prescribed medications. Got it? Good. But there are evidence-based natural approaches that can complement your treatment. Dietary changes. Omega-3 fatty acids found in fatty fish, salmon, mackerel, sardines have anti-inflammatory properties. Some studies suggest they may help reduce airway inflammation. Plus, maintaining a healthy weight is crucial. Obesity significantly worsens asthma symptoms. Eating plenty of fruits and vegetables rich in antioxidants, vitamin C, vitamin E, beta-carotene, may help reduce airway inflammation. On the flip side, avoid sulfites found in wine, dried fruits, and processed foods if they trigger your symptoms. Breathing exercises. The Buteyko breathing technique involves slow, controlled breathing exercises that can help reduce hyperventilation and asthma symptoms. Pursed lip breathing. Breathing in through your nose and out slowly through pursed lips can help improve lung function. Yoga and meditation. Regular yoga practice combines breathing exercises with gentle physical activity and stress reduction. Multiple studies show it can improve asthma symptoms and reduce medication use. Plus, stress management through meditation can prevent stress-induced asthma attacks. Steam therapy. Warm steam can help open airways and thin mucus. A hot shower or steam bath might provide temporary relief. But caution, some people find heat triggers their asthma, so know your triggers. Ginger and garlic. Both have anti-inflammatory properties. You can add them to your cooking or steep them in hot water like tea. While scientific evidence is limited, they're safe to try and might provide some benefit. Vitamin D. Many people with severe asthma are deficient in vitamin D. Ask your doctor to check your levels. Adequate vitamin D might reduce the frequency and severity of asthma attacks. What you must avoid at all costs. Here's your do not list. Never use tobacco products. Smoking with asthma is like pouring gasoline on a fire. Even secondhand smoke is dangerous. If you smoke, stop. Like yesterday. Don't ignore your symptoms. That little wheeze can turn into a life-threatening attack faster than you think. Take symptoms seriously. Never stop your controller medications without consulting your doctor. Feeling better? That's because the medication is working. Stopping it is like taking off your seatbelt because you haven't crashed yet. Don't rely solely on rescue inhalers. If you're using your quick relief inhaler daily, your asthma is not controlled. See your doctor immediately. Avoid your known triggers. If you know cat dander triggers your asthma, don't adopt a kitten and hope for the best. Trust me, love doesn't conquer allergies. The emergency action plan. Here's what to do during a severe asthma attack. Stay calm. Panic makes breathing worse. Use your rescue inhaler immediately. Take 2 to 4 puffs. Sit upright. Never lie down during an attack. Slow your breathing. Try to breathe slowly and deeply. Call for help if your rescue inhaler isn't helping after 5 to 10 minutes. You're having difficulty speaking. Your lips or fingernails turn blue. You feel dizzy or confused. Call 911 immediately. Asthma attacks can be fatal. Better safe than sorry. The recovery and prevention plan. After an asthma attack or during stable periods, here's what you need to do. Create an asthma action plan with your doctor. This written plan tells you what medications to take daily, how to recognize worsening symptoms, what to do during an asthma attack, when to seek emergency care. Monitor your peak flow. Use a peak flow meter daily to track your lung function. It's like a thermometer for your lungs. Identify and avoid triggers. Keep an asthma diary. Note when symptoms occur and what you were doing. Patterns will emerge. Get vaccinated. Flu shots and pneumonia vaccines are crucial for asthma patients. Respiratory infections can trigger severe attacks. Regular checkups. See your doctor at least twice a year, even if you feel fine. Asthma management needs fine-tuning. Stay physically active. Exercise is good for asthma. Just pre-medicate with your rescue inhaler 15 to 20 minutes before exercise if needed. The future of asthma treatment. Exciting developments are happening in asthma research. New biologic medications targeting specific immune system pathways are helping people with severe asthma who didn't respond to traditional treatments. Scientists are also developing smart inhalers that track when you use them and remind you to take medications. Researchers are exploring the gut-lung axis, how your gut bacteria affect your lungs. Probiotics might play a role in asthma management in the future. And climate change research is helping us understand how changing environmental conditions affect asthma worldwide. The bottom line. Here's what I want you to remember. Asthma is serious, but it's manageable. With proper treatment, most people with asthma can live completely normal, active lives. Just look at David Beckham, who played professional soccer for 2 decades, or Theodore Roosevelt, who became President of the United States. The key is taking it seriously, following your treatment plan, avoiding triggers, and working closely with your healthcare provider. And please, don't let internet gurus convince you to stop your medications in favor of some miracle cure. Real medicine saves lives. If you have symptoms of asthma, persistent cough, wheezing, chest tightness, or shortness of breath, see a doctor. Don't wait. Early diagnosis and treatment make all the difference. Remember, by 2050, scientists predict that 520 out of every 100,000 people will have asthma. That's a huge number. But with increasing awareness, better treatments, and proper management, we can ensure that asthma remains a manageable condition rather than a life-threatening one. Thank you for watching, everyone. If you found this video helpful, please hit that like button, subscribe to the channel for more medical content that could save your life, and share this video with anyone you know who has asthma or breathing problems. Drop your questions or experiences in the comments below. I read every single one. And remember, breathe easy, stay informed, and take control of your health. Because knowledge isn't just power. When it comes to asthma, it can literally be the difference between life and death. This is Dr. Jason, reminding you to breathe deeply and live fully. See you in the next video.